John Ashton, former regional director of public health in the northwest of England. How are you?
Very good, thank you.
Good. I'm glad to hear it. I'd like to talk to you about the situation in our care homes, social care, and coronavirus. And first of all, I'd like your opinion of how accurate a picture we're getting of the coronavirus situation in care homes at the moment, because there is a delay.
I think one of the growing concerns this week is about what's going on in our care homes. We see in the daily press conferences a focus very much on what's going on in the hospitals and the deaths in the hospitals. And we're also being told that the numbers of admissions to hospitals has leveled off or is going down in some cases. And I think this is really quite misleading, because we're not really getting a decent picture of what's happening in the community, whether in care homes themselves or whether at home. And one of the things that's been happening over the last couple of weeks is that GPs are now using clinical protocols of frailty to determine which patients to send to hospital at all and which ones to leave at home, who they think might have corona. On the other hand, we've also got this very large care home population. Something like 400,000 people are in care homes. Frail, elderly people, many of them with dementia, a significant proportion of them probably within weeks or months of end of life. Now, the primary concern I have is that these seem to be being written off as though they don't really matter. And by not making them visible in terms of counting the number of deaths that are taking place, that reinforces this sense that these very elderly, frail folk are not really important. We've seen in recent days a succession of reports from individual care homes with 5, 10, even 15 deaths. One in Durham yesterday, 13 deaths in the one care home. But because these patients have not been tested for coronavirus, and because the patients who are dying at home have not been tested for coronavirus, it's highly unlikely that it will be recorded on their death certificate that they have died as a result of corona. So this is leading to a highly significant number of deaths that are not being attributed to the coronavirus. It suits the government to focus just on hospital deaths and to have us thinking about those and ignoring these other ones. Suggestions from Italy indicate that there may be 50% more deaths taking place in the community. So instead of looking at the 11,000 that we were offered yesterday, we could be looking at 16 or 17,000 deaths total altogether so far, or maybe more, but we just don't know. And it all comes back to this failure to test. Until we are testing at scale, we don't know where the virus is, we don't know what levels the virus is, and when it comes to the discussion about easing off on the lockdown, we don't know what we should be doing, because we don't know where it might be safe to ease off in the absence of testing.
So that's sort of my next question to you, was whether you thought this sort of misreporting, if you like, is a deliberate ploy to sort of play down the number of deaths, or rather an unintended consequence of a lack of a mass testing program.
What we've seen from the very beginning of this emergency 10 weeks ago now has been an unwillingness to be frank, open and transparent. And we see these farces of press conferences on a daily basis where ministers and advisors duck questions and don't answer them. And where this question of the numbers is part of that overall confusion of information, let's call it that. Viewers will have their own opinion about when this misleading statements, this avoidance of questions, when it really becomes very different to distinguish that from frank lying about the situation, avoiding telling the truth and actually telling lies. There's not a hair breadth between those two when it comes to this point. And when we look at the extended lockdown, which we'll almost certainly have to endure, you need to take the public with you by being open and honest, treating the public like adults, not treating them like kids. If you treat people like kids, don't be surprised if they behave like delinquents.
You mentioned Italy there, John, and there's similar data coming out of the rest of Europe that would indicate that care home deaths are roughly double hospital deaths. So do you think it's fair to assume it's a similar case here in the UK?
I mean, I'm a medical academic and practitioner by background. I believe in sticking to the evidence, which is why it's so frustrating not to have the numbers freely available so that we can crawl all over them, criticize them, see how robust they are, what to believe. We just don't know what's going on at the moment. We've got a very partial picture with the hospital deaths. So it could be very much higher, but I wouldn't want to claim it's very much higher in the absence of the data. I think it's fair to say it probably is quite a lot higher than we're being told.
What do you think that speaks to then? I mean, do you think this amounts to a word that's been used as forgotten or abandoned to describe our elderly population, our population in need of care? I mean, do you think that's a fair assessment?
Well, clearly the care home population was on nobody's radar. You have to remember that the way in which we look after elderly people in our society is very fragmented. There's been discussions for years now about how to put it on a better footing. There's lots of different types of care home provision. There's lots of private involvement in it. There's places that are like big old mansions in the countryside. There's some modern places which are really big, which might have 120 or 130 people in them that are more like modern institutions. My own hope is that what should come out of this crisis is a national care service with standards and with appropriate levels of care for everybody. But at the moment, we've got some of the most vulnerable people being looked after by very poorly paid and often not very well trained staff. Many of them, English is a second language, and we really need to put it on a proper footing.
And there is also the element here that because family visits, I mean, obviously most of these places are on social shielding, lockdown, no one can go in. Family visits aren't happening, and therefore oftentimes those family visits would serve to be a base level of scrutiny of whether the appropriate level of care is being provided. And now that that's not happening, there is even less oversight of the quality of care being given.
I think one of the most valuable ways of monitoring what's going on in care homes is through the visits of family and relatives who are able to keep an eye on things where they're going wrong. I mean, I've had personal experience of a care home where there was no fresh food. It was all tinned food, for example. These kind of things can be brought to attention if you've got family members going in and out. The inspection regimes for these homes are not very effective. We need to really revisit all of this after this is over. But in the meantime, what we've got is a situation where these frontline workers and the patients are at risk. The personal protective equipment is clearly not getting in to these workers. And you're talking about people who may be dealing with patients who may be doubly incontinent, where they're dealing with urine and feces on a daily basis, needing to clean up properly, needing to have high standards of hygiene, with the virus being particularly highly found in feces as well as in secretions from the nose and larynx. This is just a nightmare scenario. And I think what we are going to see over the next week or two or three is a growing tally of deaths in care homes. And probably we won't really know what's happened until sometime next year, when the emergency is over and politics gets back to business as usual. And this issue might get buried in a long-term inquiry when everybody's trying to bury the memories of this and get on with their lives.
On the point of the personal protective equipment, PPE, the Health Secretary, Matt Hancock, described that as a precious resource. I mean, what was your response to that and the inference from describing it as such?
I think the Secretary of State's description and the way he put that as a precious resource and implied that there were staff who were frivolously using personal protection was a disgrace to our frontline workers, who require the utmost respect and support at this time when they're putting themselves in harm's way by caring for other people.
Fair enough. And then just finally, John, I'd like to ask you, I mean, the government doesn't appear to know the number of NHS staff killed by the coronavirus. I mean, even this morning, Therese Coffey was on this morning and she couldn't answer when Piers Morgan asked her what the number was. And yet we know how many litres of oxygen the Prime Minister received when he was in the ICU. I mean, what do you think that speaks to more broadly?
I think the fact that ministers of government are unable to tell us how many health workers have died from corona is beyond shocking. These are people who've been put in harm's way in the front line for public service to save life, and the government can't be bothered to pin down the numbers on a daily basis. It's beyond shocking.
John Ashton, former Regional Director of Public Health in the North West of England, thank you very much.
Thank you very much.